Well, welcome everyone to our WALGA webinar series on local public health planning. Before we start, I'd like to begin by acknowledging the continuing connection of Aboriginal people to country, culture and community. We embrace the vast cultural diversity throughout Western Australia and acknowledge that I am joining you here from Boorloo, Perth, on the land of the WALGA people of the Noongar Nation. I'd like to pay my respects to elders past, present and emerging leaders, and extend this respect to the traditional owners of the land on which you join us from today. I'd particularly like to acknowledge any Aboriginal and Torres Strait Islander people on the webinar today and acknowledge your contribution to the health and wellbeing of your mob, your community, and all of the public sector work that we're doing here together. So WALGA has developed this series to support our members, all local governments across WA, on their local public planning development journey. The design of the series has been informed by consultation with our members, but also through collaboration and consultation with the Department of Health, the amazing health service providers, the Metropolitan and WA Country Health Services, and organisations such as Suzanne's that are participating today, Injury Matters, service providers and other amazing health promotion and public health experts in the field. What we gleaned from our consultation early on was that many local governments are embarking on the public health planning process for the first time and are really seeking support for the actual planning process. So there is amazing activities and events and professional development offerings from organisations on particular subject areas like cancer prevention and injury prevention, such as that Suzanne's working on, but really a lot of officers working in local governments need some of that process-based support. So the first 4 webinars that we've programmed focus on different aspects of the planning process. Our first webinar that we ran a couple of weeks ago was really on the pre-planning phase, doing the environmental scan across your local government's existing work, mapping that against the state government's priorities and objectives in the state public health plan, and picking up what you already are doing, that work that's ripe to pick up and put straight into your public health plan to acknowledge that contribution that you're already making to the health and wellbeing of your community. I've popped in the chat a link to WALGA's webpage on public health that has all the links to, you can view that first webinar again. It's been recorded just like this one has been. And we've got the slide presentation from that webinar series as well. Today's presentation webinar will also be recorded, and Suzanne has really generously offered for us to publish her slides after the event. So please don't feel like you have to furiously take notes throughout today. Just listen, absorb, ask questions as you go. We'd love this to be interactive. What else was I going to just mark? I've also just popped a link in the chat to the registration for our next webinar, which we unfortunately had to reschedule, but it will be a data spotlight on accessing data on children and young people in your local government area through the Australian Child and Youth Wellbeing Atlas. The project team from UWA will be coming to demonstrate how to utilise that platform to really dig down into data on the health and wellbeing of kids and young people in your area and how that can help build out your health data profile and inform some of your action planning and priority setting. So I've popped a link to that in the chat. I just need to let people in, unless Hannah's online and can do that for me. Let me just see. Oh, they all seem to be coming in. Hi, Colby, how are you going? Okay, so I think that's all the admin out of the way. I've got the chat open and I'll be monitoring it for questions. So please, if you've got questions along the way that you would like us to ask at an opportune pause in the presentation, please just type it in and we can monitor that and ask it, just so that we keep our presenters on track. And then we'll try and leave time at the end for some Q&A and discussion, because we'd love to hear if you've been through this process or you've got examples that you might like to share of a similar kind of experience that could help us build that practice. Okay. So many of you will need no introduction to our speakers today, as they are both exceptional leaders in their own fields and highly respected practitioners in the public health space. Suzanne Butler has recently stepped into the General Manager role for injury prevention at Injury Matters, which is an organisation that is focused on, as the title says, injury prevention. But they cover a great scope of work and areas of focus, right through from injuries arising from mental health, mental illness and self-harm, through to road trauma, but also falls. And Suzanne, help me out. I'll let you cover off in this in your presentation.
Yeah, that's all great.
But you might have seen or even benefited from some of Suzanne's training and workshops that she's delivered to local governments over the last 3 years in her role there. And I'm also thrilled to welcome Kelly Wilson, the City of Mandra's Health Promotion Officer, who has been leading the development of the City of Mandra's second local public health plan. I hope I have that right, Kelly. It is your second, I think. And Kelly is also co-convener of the local government's Health and Wellbeing Group, which is a huge network, which I know many of you are a member of. They met last week for a fabulous session. I learned so much. And Kelly's just an amazing support to me as well. I want to thank you for agreeing to speak today, Kelly. And a wonderful link between Suzanne and Injury Matters and Kelly is that the City of Mandurah was a finalist in this year's Injury Matters Awards, Injury Prevention Awards, for 2 projects that they have run: Improve Your Health and Move Your Body. And I believe that was a partnership, or the award was, they were a finalist alongside the South Metro Health Service, which worked with them on those programs. So a great example of partnership there. Today's webinar is going to focus on moving, once you've collected all your data and you've gathered your evidence, perhaps some of the numbers are being crunched. What next? How do you move from that data to identifying what your local risk factors are in terms of maintaining people's health and well-being, and then honing down to identify what your local priorities are for your local community? So our first webinar really looked across the state public health plan's objectives and priorities. They are statewide priorities. And today we're going to look at how once you've gathered your data, how do you actually use that as a tool to help you narrow down your focus to those local priorities and actions? So I will hand over to Suzanne first. Suzanne's going to guide us through that process in a more sort of providing providing that sort of process guidance. And then we'll ask Kelly to step in afterwards and show how they've put that into practice at the local level in Mandurah. All right, so I'll hand over to Suzanne.
Thanks so much, Chris, and thank you very much for inviting me to come and present today, and also really happy to be presenting with Kelly today. As Chris said, that we've had a lot of engagement with the City of Mandurah with the work that they do around injury prevention and safety promotion, and it does include our Stay on Your Feet grants. So for those of you that are interested, they're currently open at the moment. So while I just get myself sorted, I thought I'd give a little bit of a plug for them. The information around those grants are on our website at the moment, and they're for grants up to $5,000 for falls prevention activities. So I can't see any of you, but hopefully you can see my slides and everything's working the way it should be. So as Chris said, my name's Suzanne Butler. I'm General Manager of Injury Prevention, and I wanted to start by just putting up my email address there. All the slides will be made available, as Chris said, but I just wanted to reiterate that 45 minutes for me to go through how to set priorities is really touching kind of the surface, and there's lots of individual issues you may come across or concerns, and all local governments are different. So at any point that you would like additional support, particularly if it's related to injury prevention or safety promotion, but also if it's related to the process of or skills that are needed to develop a public health plan or to set your priorities, we are available to support in that. I'm going to give a little bit of information more specifically about the scope and why Injury Matters is involved in supporting local governments with public health planning in a minute, but my email address is there. We also have Tegan from Injury Matters online today. Tegan's first day was yesterday, but Tegan will also be helping to support local governments with public health planning moving forward. So the focus of my presentation, as Chris said, is going to step through how you can bring together data, risk factors, determinants, and engagement with community and stakeholders to set clear and evidence-based public health priorities. The process will focus on structuring the way that you use the information that you already have access to. And I do acknowledge that the time frame that's left to develop public health plans is relatively short. So I'm going to try and cover the steps that you can use to determine your priorities and to identify the work that you're already doing, and combine that with engagement with your community to set those really clear priorities for your public health plan. I know you've previously had that session looking at the state public health plan, the requirements of the plan, and aligning your local public health plan to the state plan, so I'm not going to touch on that today. My focus will really be about helping you to identify where resources and information can be focused for greatest impact. And as Chris said, my slides and a couple of the documents that I'm going to talk about today will be made available to the attendees of the webinar. So I would like to also start by acknowledging the traditional custodians of the land that I am joining you from, the WALGA people of the Noongar Nation, and pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people joining us today. So I guess what my presentation is going to cover, I'm going to give you a little bit of information about Injury Matters and the local government support that we can provide. We're going to look at data and health profiles. So a solid health profile really does underpin a strong public health plan. So we'll look briefly at the types of data that's available, from population level surveillance to local injury data. I know there's that upcoming webinar, so I'm not going to go into data interpretation, but it is important that I provide support on how to use that data, because it's really important in setting priorities, and it helps us understand who's most impacted and where the greatest need is in our communities. We're going to look at risk factors and determinants of health. So health outcomes aren't random. They're shaped by both risk behaviours and the broader determinants of health. We'll touch on the major risk factors like alcohol, physical activity, smoking, but also social and environmental factors, and they all need to be considered together. We'll look at service and asset assessment, and I know that that was covered in the previous webinar quite a bit. So it's not just about identifying the problems or health issues and concerns that are within your community. It's also about recognising the strengths of your community. So local governments already have a really wide range of services, facilities and programs in place. So assessing what exists can help us to avoid duplication, can help build on success, but also help identify the real genuine gaps. We'll cover community and stakeholder engagement. So community voice is critical to the development of your priorities. By engaging stakeholders like residents, schools, service providers, community organisations, we capture lived experience and local knowledge, and it ensures that our plans are relevant, culturally appropriate, and also have buy-in moving forward and build really strong partnerships for the implementation phases. We'll talk about setting local priorities. So once we combine the data, the assets and engagement, we can start to identify what your local priorities really need to be. The process will be different for every local government and can be influenced by things like geographical size, your population, the resources that you have available in your location. The process really is about focusing on issues that matter most in your community and where your local government can have influence. So today I'll give you an example of a short activity to practice interpreting injury data, and I'll make the resources available for you to use that after the webinar, as well as an activity that you can do within your community and your stakeholder engagement to help map out those the gaps and opportunities. So then we'll talk about from priorities to action. At the very end, I have some information around setting aims, objectives and activities. And if I go over time, which I am known to do, bit of a chatter, that information will be available in the slides, but I won't cover it in the presentation because it's really about that next step. But it's looking at how your priorities need to be translated into action. It can also help you with setting priorities because it can help you understand what is a priority that does have a clear aim and objective, is measurable and is achievable. So looking at that SMART objectives. And then we'll finish off with looking at next steps and some available resources, including the updated local government guide that Injury Matters has, our data sets and examples of programs that you might want to use. So quite a bit in a short period of time. So hopefully we'll get through it all. So as Chris said, I'm from Injury Matters. We are for safer people and places, and we have 3 flagship programs. Those programs are Stay on Your Feet, which is a falls prevention program for older adults. We have Road Trauma Support WA, is our program that provides information support and specialised trauma counselling services for people that are affected by road crashes in Western Australia. And No Injury, and No Injury is the program that supports our work with local governments. And the scope really in terms of what we're doing is to build the knowledge and skills and provide networking opportunities to support people working in injury prevention to ensure that programs and interventions are evidence-based. And so in alignment with the public health planning process and supporting local governments, while we are focused on the inclusion of injury prevention and safety promotion as a priority in public health plans, we also are looking at the process and supporting that evidence-based process for developing a plan. I'm not going to go into this. I just will say that the work that we do does align to the state public health plan. I know this was covered in the first workshop, so I just wanted to encourage you to really keep that Aboriginal health and wellbeing and equity and inclusion lens across all of the areas that we're going to talk about today. So in terms of supporting public health plans, Injury Matters can have influence or support at various stages of the public health planning process. So I will go through each of these, but basically we can support right from the pre-planning stage, I guess, but in terms of developing a health status report with our data sets, to help establishing objectives and priorities, and specifically around injury prevention and safety promotion, we have our guide that can support that and does actually contain objectives. I'll be talking about that a little bit more at the end. We can provide expert advice, we can provide tailored support and consultation one-on-one with local governments around developing a public health plan. And we also have a range of resources available on our website, the grants that I've mentioned previously, education sessions that we provide, and training as well, which is all on our website. I'm not going to go into this, but it's a resource that's on our website that goes more specifically around the areas that you can contact us for support. So in terms of the public health planning process, it can be a bit of a journey, I guess, for a lot of local governments, and there isn't a whole lot of time left in before the deadline in June next year. The focus really today for me is around establishing objectives and policy priorities, but we need to go back to developing a health status report really to ensure that we're determining where our priorities need to be and what we need to consider when we're setting those priorities. So we're going to be talking a lot about qualitative and quantitative data today. Both of those things combined are needed to determine what your local government priorities will be. Quantitative data helps us determine the prevalence or incidence of health issues. So it's used to gather lots of information without in-depth detail. So an example would be the information that's provided in your health profile data sets, local surveys that you might do, census data, those sort of things. And then qualitative data is used to elicit discussion with community and stakeholders. It's qualitative approaches provide depth and context. So it's telling you the why and the how behind those numbers. So we're going to cover both of those in terms of your setting priorities. Again, I'm not going to go into a huge amount of detail because I know that you'll be talking about data in the next webinar, but one of the first stages of public health planning is understanding your community's health profile. So the profile will document everything known about the health of your community as well as the determinants of health. So the data that's provided by the Department of Health's EPI branch, which you can access through your health service in your health and wellbeing profile, it should really be the basis, the foundation of developing your health status report. And I'm assuming most of you have engaged with your health service and accessed that report. So making sure you are using the most up-to-date data, and we do know that there's often data lag, but ensuring that you're using that most up-to-date data to determine your priorities is ensuring that you're developing them based on the best evidence possible. I've also included some other links there to areas that you might want to have a look at. I'll be talking a little bit very briefly about CIFA, but there's some other areas and that you might, or other organisations you might want to get data through. And then specifically in terms of injury and community safety data, there's some organisations that provide information that you can access as well. So our health status profile really should be made up of a range of different data sets and information. So it should describe current demographics and health status of your community. It should identify health issues, risk factors and causes of illness within your communities, and it should also highlight priority areas for action. In terms of demographic data that you should be including, it and why, it helps to build a picture of who is in your community. So what does your community look like? And I think it's page 9 and 10 of your health and wellbeing profiles that provide that information. You can also get broad demographic data from the Australian Bureau of Statistics, and it can be used to describe the demographics of your community, and it can include things like the average age of your community, family structures, proportion of the population that are Aboriginal and Torres Strait Islander descent, what proportion were born overseas or speak a language other than English at home, what proportion of your labour workforce is unemployed, housing, education levels, income, transport, etc. So it should also include the CIFA index, which is the socioeconomic index for areas, and it's a measure of social and economic wellbeing for your local government. It provides an indication of either lower or higher levels of disadvantage. Next, you'll begin to look at the health status of your community. So using the data provided by the EPI branch, as well as other organisations and the data set, for example, that Injury Matters provides, you can get a better picture of your community's health status. So health status includes life expectancy, prevalence of chronic conditions such as cancers, heart disease, dementia, arthritis, infectious disease and injury. At this point, some key indicators to look for would be what are the leading causes of death and hospitalisation within your local government? So who's affected by the issues in your community, and is there a specific group? Is it younger people? Is it a specific gender? Those are the things that you should be looking at when you're assessing the data that you have access to. Specifically in relation to the data that Injury Matters can provide, I've put a little QR code there for that takes you directly to the request form on our webpage. But we provide data sets that provide more specific information relating to injuries within local governments than what is included in your health and wellbeing profile. So in the data request, you'll get a data table, an injury report, as well as data support information. We can work directly with you to help you interpret that information and to help set injury prevention priorities as well as activities within your public health plan. But this is kind of an example of the data set that you'll be provided. If the number is less than 6, you won't be, it's restricted, so we can't actually provide numbers, but we provide in the tables and in the graphics there priority areas for you, and we can help you interpret that. So just wanted to flag that one. I will, after the webinar, also send out or get Chris to send out our injury worksheet. We usually run these sessions as a face-to-face workshop. So as part of the activity in the workshop, we would get you to do this. And this is something that can be replicated not just for injury, but for other area health conditions and risk factors. So the injury worksheet, the questions that we get people to look at is what are the leading injury areas within your local government based on that data set that we've provided? What population groups are most impacted by injury, and do the leading injury areas for the whole population look different for a subgroup? So, for example, I don't think I've ever seen a data set that doesn't have falls as a priority area in terms of the hospitalisation data. And so when you're looking at that in the tables, you can see the people that are most affected by falls within communities is older people. And so you can have a look at those sort of things for burns and scalds, for poisoning and those kind of things based on our data set. You can then use a similar worksheet or similar kind of format to look at priority areas for other health conditions or risk factors within your community. If after the webinar you'd like some support in how to do this, please get in touch with us because we can definitely do that with you. So determinants of health are really important to consider when you're setting priorities for your public health plan. So determinants information is in the state public health plan, and that's where this graphic on the left-hand side has been taken from. Determinants of factors that can both raise and lower the risk of ill health and injury occurring. You can determinants combine to influence the health and safety of individuals, but also whole communities. There's 4 different areas: social, environmental, behavioural, commercial, and the state public health plan does also cover separately cultural determinants of health, which is really important that you familiarise yourself with and address specifically in relation to that Aboriginal health and wellbeing overarching objective of the state public health plan. But social determinants of health are the conditions in which people are born, grow, work, live and age, and the wider set of forces and systems shaping their daily life. So that can include things like economic policies and systems, social norms, social policies and political systems. So Generally, it's not one that is broadly considered within public health planning because of the limited impact of local governments in the short term. But it is really important to understand that people who are most affected by social determinants of health are disproportionately affected by ill health and injury. Excuse me. Environmental determinants are closely linked with risk factors of injury and ill health and the social determinants of health, and they do influence one another. So environmental determinants include what surrounds us, where people live, work and play, and that can include things like the physical and built environment, social environment, natural environment, and it's clear to see how local governments could have influence in that space. Behavioural determinants are those that are linked to actions that people take every day that either increase the risk of ill health or injury, and they're called risk behaviours, or decrease the risk of ill health and injury, and they're often called health protecting behaviours. Sometimes it can be difficult to see how local governments may influence. We've had a lot of questions around how local governments can affect the behaviours of people, but there is really clear ways, programs and interventions that local governments can undertake that do impact people's behaviour. Examples of behavioural determinants include knowledge, attitudes and beliefs about health conditions and injury, people's coping skills, their risk-taking choices and behaviours, and I've listed specifically related to injury prevention some of those things there that that local governments could influence. And then commercial determinants of health are the activities of the private sector that impact public health either positively or negatively. And they can include things like products and services created to gain financial profit, marketing strategies, working conditions, political activities. And although commercial determinants are generally occur at a global scale, their effects are seen locally. So, for example, through exposure to advertising of unhealthy products in public spaces and higher density of alcohol outlets in lower socioeconomic areas, that is a commercial determinant of health. So this is where local government policies might start to affect where you look at your activities and interventions, sorry. I guess kind of what I really wanted to focus on today is around risk factors, because through the data that you gather and through developing your health profile, looking at who's in your community, the health conditions and injuries and communicable diseases that might be influencing your community or impacting them, you could potentially identify a really large number of things. So sometimes it can be really difficult to look at your data and use that to determine your priorities. You're often not comparing apples with apples, and so a health condition or an injury may significantly impact one proportion of your community and less so in other areas. And so how do you set your priorities based on that varying data? So by focusing on risk factors, rather than individual health conditions, local governments can address the underlying causes of that contribute to multiple diseases, injuries at once, so creating broader and more sustainable benefits for the whole community. So factors that have a positive influence are known as protective factors, and those that have a negative influence are known as risk factors. So risk factors are conditions or behaviours that increase the chances of adverse health conditions. So those can include things like chronic disease, injury, communicable disease, or environmental harm. And many risk factors like climate impacts, alcohol, nutrition, and the built environment cut across multiple health outcomes. So from respiratory illness and mental health, injury and chronic disease. So the next step in developing your health profile and to support setting priorities within your public health plan, you'll need to look at the risk factors to understand the prevalence within your community. The risk factors that I have included there, hopefully you can interpret them using the icons, have been, they're also included as indicators in your health profile provided by your area health service, are important as they can affect a range of issues. So, for example, alcohol consumption not only increases the risk of many cancers, heart disease and stroke, but it also impacts all injuries within a community, as well as things like antisocial behaviour. So physical inactivity increases the risk of cardiovascular disease, type 2 diabetes, some forms of cancers, as well as falls injury. So by implementing activities that are addressing risk factors, particularly in your priority populations, which you'll have based on your data sets, we can contribute towards the prevention of many different public health issues. So key risk factors that local governments should consider including or addressing within a public health plan and your priorities include nutrition. And looking at your data, you might look at the levels of fruit and vegetable intake, as well as the consumption of fast food within your local government. Physical activity, so understanding if your community are meeting the physical activity guidelines or if they're exceeding the sedentary behaviour guidelines. Looking at your overweight and obesity data, alcohol consumption, so are people drinking more than the recommended guidelines for alcohol consumption, and also who is doing that, like what groups potentially. Looking at illicit drug use, tobacco and vaping, so what's the prevalence of tobacco smoking in your community and the associated hospitalisations and deaths from that, as well as climate change. So that can impact things like ill health, particularly things like heat exposure. So we know that has a significant impact on things like injury, as well as chronic health conditions and heart attacks and things like that. This is a document that I will provide following the webinar. So basically, we've developed this so that you can use it to help look at developing your health status report. So there's 3 pages within this worksheet. It includes the demographics and health status, which you can see at the front. So it's really a very simplified version of the data that you might need to collect to then put and interpret and put in your public health plan as the basis of identifying who your community is and what they look like. The second page looks at health issues and risk factors. So it's really helping you identify what I've just been speaking about. So if you've got all these health issues that are coming up in your data, what risk factors are influencing or could have influence over those health issues? And then the third page is around interpreting all of that together to set your priorities. So I'll ensure that this is sent to Chris and sent out to all the attendees. Again, once you've got this document, please feel free to get in touch with us if you'd like support to be able to complete it, or if there's anything that you need clarification on.
Suzanne?
Yes.
I'm just wondering, do you want to take a breath? Do you want me to just see if anyone's got any questions on what you've talked about, just because I'm conscious how hard it is to maintain such a big amount of information. Has anyone got any questions that they'd like to ask Suzanne just about the material she's gone through so far? It's okay if you don't, we can keep going.
It's a lot to take in. There's a lot of information and I'm kind of trying to fly through it so that I...
Just so you know from the chat, people are very actively following your QR codes and links and other things that you're talking about, Suzanne, and I'll follow up to make sure with you afterwards that those QR codes are properly activated and things like that. If people are trying to use them now, just hold 10 and we'll make sure that they're all
absolutely. Yeah,
working and before it's published. So don't panic if you can't find those. But it doesn't sound like anyone's got any pressing concerns.
Great.
Cool.
Yeah.
All right, we'll keep going. Thanks.
Sorry, just going back to this is a really helpful. So what we usually do within our workshops is we'll run our first workshop and you'll do that first worksheet of identifying your injury data priorities, and then encourage you to go away and do those for other other health conditions. This is kind of like a bit of a take-home homework sheet that we developed, and so the second workshop we would come back and really, that's where we would really look at people's the risk factors and health conditions that health issues that they've identified, what their communities look like, and really help them to set priorities. So again, just encouraging you, if hopefully it's all making sense, and the emphasis on risk factors and addressing them within your public health plan is coming through what I'm saying. But if it's not and you'd like some more clarification, or you think of questions afterwards, please, again, feel free to get in touch with me. Sorry, 2 secs. It's my presenter view. There we go. So when we talk about public health plans, it can be easy to think of them as a requirement, so something that we just that is needed to be done to meet the legislation. But the real value in how a plan comes together and how well it reflects is how well it reflects the communities that you're serving. So that's where stakeholder and community engagement comes in. So we've talked about the quantitative data, so looking at the data sets and what the numbers are telling you. This is now looking at the qualitative data. So engagement, you can think of that as the bridge between policy and people. It's what turns a plan from being a document on the shelf to being a tool that really does improve health outcomes for your community. So without engagement, we risk designing plans that look great on paper, but that are not providing any connection to the real challenges or opportunities within our community. But with engagement, we build plans that are relevant, practical, and supported, which makes them far more likely to succeed in the long term. So when we're thinking about stakeholders and public health planning, if you can think about them as a cast of characters who's involved. Now, I will say that it really does depend on the size of your local government and the resources that you have available at the moment, which is including time, to influence how much engagement or what that engagement will look like. So for a very, very small local government, your engagement is going to be very different from a very large metropolitan local government, as it should. So I will just caveat that I understand there's a lot of local governments out there that will look at this and go, we don't have a hospital, we don't have a podiatrist, we don't have an Aboriginal health service or a senior centre or any of those sort of things. But it's really about looking at what your community looks like and ensuring that you are engaging with the people within your community that you need to. So community members and community groups and cultural organisations are a really important stakeholder to engage with. You want to have a look at your demographics. And if you, for example, have a large proportion of people who don't speak English as their first language or were born overseas, or a really high proportion of Aboriginal and Torres Strait Islander people, or a high proportion of older people, that can help guide your engagement. You need to ensure that you are actually engaging with those people in the development of your priorities for your public health plan. Education providers can also play a vital role. So we're looking, early childhood centres, if you have them, through to schools, TAFEs, universities. They can influence lifelong health and learning, and can also be really strong partners in promoting wellbeing. There's health and aged care services, so that can include general practice, hospitals, allied health professionals, community health services, residential aged care, and those organisations bring important data to you potentially, but also insights into the challenges that those people are facing day to day. We have obviously local and state government. So local government, your internal staff who deliver programs, but anyone else working with the local government is a really key stakeholder, and more often than not is the first point of call in terms of engagement. Your internal engagement within the local government is a really great place to start. Business and economic sector, they're employers within your local governments, but you might have business chambers, sporting clubs, and even food outlets that you might want to engage with, and they are the organisations that are influencing where people work and eat and socialise and things like that. And then there's environmental and infrastructure. So you're talking about transport providers, housing developers, environmental groups, recreation providers, all of those kind of things. So if we think about them as a cast of characters, the strength of the public health plan comes from recognising each of them as part of your story and creating opportunities for their voices to shape the direction of your public health plan. So what happens if we don't engage though? So if engagement is tokenistic or absent, a public health plan risks becoming a compliance exercise, so something that just ticks that box. Without input from the community and stakeholders, plans can miss actual need and priorities of local people. There is also the opportunity for local governments to address perceptions within your community through that engagement. So one of the things that we often recommend if you are doing any sort of community engagement is to set the scene with the data that you have, because you may have a community that is thinking that a specific issue is a really prominent issue within the community. It's not saying it doesn't need to be addressed, but your data might be giving a different story. So an example of that is we engaged with the local government and they were working with seniors, and the seniors had a really strong feeling that senior safety, so physical safety within their homes and within the community was a big issue. The data said something different. So the local government determined that there were some steps that they needed to take to address that, but also they were making the community perceptions kind of more accurate in what actually was a risk. So that's another opportunity with engaging with your community. So when people also don't see their voices reflected in a plan, there's limited ownership and you potentially might not get support when you come to that implementation phase. There's a real cost in terms of missing partnership opportunities. And so without engagement, the impact of the public health plan is reduced. So that's the challenge we're trying to avoid. We want to make sure that public health plans are living and meaningful documents that better deliver what is needed within the community. So you need to plan your approach in terms of how, again, I could do a full workshop just on how to engage stakeholders. At this point, I will flag Injury Matters does have a stakeholder engagement workshop coming up that's listed on our website. I'll also list that link or give that link to Chris at the end. It's being run by AHA Consulting. So if this is specifically something that you're more interested in learning about, then that opportunity is coming up. But you could be looking at, and again, it depends on the size of your local government and the resources that you have available. The way that you engage with your community and stakeholders will be significantly impacted by those things. So resources, like I said, which includes time. So you really want to be looking at the most beneficial information at the moment, because you've only got 9 months left, rather than doing a whole range of different surveys. Where are you going to get the best information in the quickest amount of time at the moment? So it could include surveys and questionnaires. So that could be short surveys delivered online, paper, or both, to collect feedback on local health concerns and lived experience. You could do focus groups and workshops, and they're particularly good if you're wanting to get information from diverse groups. So specifically, if youth has been identified as priority area, older adults, Aboriginal communities, it can help you delve deeper into those localised issues. Public forums and town halls can be good, depending, that can be risky as well, but it can allow stakeholders to raise concerns and suggest potential interventions or improvements if they're run effectively. Stakeholder interviews, so you might want to interview people one-on-one, which could include health professionals, NGOs, local businesses, educational institutions, for their expert perspectives around the communities they're servicing. And also a great one is to to leverage existing networks and committees. So there's already probably a whole range of networks and organisations and advisory groups and things within your community that you may be able to leverage that off. I will also say that local governments are often great at doing surveys and collecting data. So having a look at what you've already collected, the information that you've already got, is also really supportive in terms of, you know, identifying we don't need to ask that question because we've already had that, or we've got this response, but we're missing this group of people in that survey. So we specifically just want to go to this group and ask a question. So having a look at that information is really important.
I was literally just going to jump in and say that, Suzanne, to say I think often community consultation and engagement is seen as a really big burden and time drain, but in actual fact, some of it can save you work down the track because, and also you might, if your local government has an age-friendly plan, a youth action plan, it should have a disability access and inclusion plan. You're capturing some of those issues around or considerations around equity and inclusion in those consultations. So have a look at how current that they are. Perhaps there's been just some recent consultation by your communities team or your your planning team or your access and inclusion officer, or even your corporate services and governance team for your corporate strategic plan, community strategic plan.
Yeah.
The other thing I was just going to say is you might, through your engagement with your community groups, you might find that there's something low cost and low, low effort that you could offer that group that would have a high impact, such as offering a room or a facility or cross-promoting their events through your e-newsletters or your library walls and notice boards that you could, use to start building a bigger relationship down the track. And then you can pop that into your local public health plan around some of your partnership work. So you get you don't only test ideas through that consultation and engagement, but you might actually pick up some useful material that you could put straight into your plan there.
Yeah, absolutely. And I think moving on to this activity, which actually does say exactly what you're suggesting there as well, part of this mapping of what is already existing and what opportunities there are, a lot of the time, the existing programs are things that other organisations are doing, but that local governments, as you said, can add value to. So I just wanted to show you this risk factor activity that we did at one of our workshops. One of the reasons I'm showing you this is a great, very simple but great activity to do both internally with people within your local government, but also if you do go down the track of doing a forum or engagement sessions with your community members, they are able to potentially identify some of the existing activities and programs that are happening that you may not think about or may not know about, and that could either feed into your public health plan or provide those opportunities to add value, as Chris was just talking about. So this is one we did for physical activity, but you could do it for nutrition, mental health, alcohol, any of those risk factors. And it's I think, can you still see my presentation or did it just disappear?
Sorry, that was my fault.
Okay, good.
Sorry,
my computer was having a meltdown before. I'm thinking, as long as it wasn't me.
Sorry, Suzanne.
No, you're right. That's fine. Sorry. Bring back. That's cool. What we got people to do was to form their groups. We gave them a risk factor, and then we wanted them to brainstorm existing or known activities and programs and initiatives that are currently happening within their local government. So this is not reflective of a specific local government. This was a group of people, just so you know. But you would look at it at the things that are existing for you, and then the opportunities for new expanded activities or collaborations or organisations or assets that you might have. So we really do try and get people to think outside the box. And so, you know, one thing here might be for physical activity was great that they picked up that having water fountains in local spaces was beneficial to encourage physical activity, because in those hotter months, people knew that they had access to water. You can see all of the examples on there. I'm not going to go into them, but it takes everything from planning guidelines, footpath replacement programs, right through to specific programs such as good sports, facilities like PCYC and aquatic facilities, the footpaths and cycle paths. You can get more specific into it, talking about exercise programs. But yeah, it's kind of a capture all, hopefully, and then add on the opportunities. So some of the ones that were identified, which I thought were great, were social prescribing pilots. So that's a program, you can Google it, but it's working with health services so that they can do social prescribing for health conditions for people within the community. So it's emphasising linking those health services and individuals to recreation facilities, for example. So a GP might do a social prescription, to a specific class at your recreation centre. So providing digital activity mats, providing discount gym and recreation passes for at-risk groups. So that could include older people, younger people. It could include ensuring that you've got diversionary programs, which then is going across multiple risk factors in relation to young people. Walking school buses, subsidised or free programs, or also providing subsidised venue hire for physical activity providers, particularly if it is for those at-risk or vulnerable groups that are showing up in your data. So that's an example of an activity that you could do when you're doing your engagement with your communities. I'm not going to go into details of this because I think I'm very quickly running out of time, but this is around some steps that you need to take to ensure that you're publicising your engagement opportunities so that you're reaching who you want to come. You're facilitating it inclusively. So for most local governments, it wouldn't be, we're just going to do an online survey, particularly if you've got groups of people within your demographic population, or a community has lots of people who don't speak English as a first language, or are an older population who tend to not be using the internet and digital methods. You know, thinking about how you're going to reach the people that you need to reach. And then you need to document the feedback that you've got and also provide that back to the community. So in terms of your engagement journey, start small, start with your engagement, internal engagement, and it can be really overwhelming to think about all the engagement that you might need to do. But map your stakeholders, understand who has interest or influence in community health and public health. Start with your internal teams within your local government, then look at health services, schools or community groups based on your data. You need to listen deeply. So use the things that you've decided to implement, such as workshops, surveys or forums, or even informal conversations to gather insights from your community and your partners. Connect the dots, take what you've heard and make it flow directly into the priorities of your public health plan. That way the plan reflects the lived experience of your communities rather than just your assumptions. And finally, it's really important, as I said, to close that loop. So you need to be reporting back to the people you engaged with. You've built partnerships with those people now. That step's often missed, but it's really important for building trust and developing those ongoing relationships, because they're going to be your partners in the implementation of the public health plan. I just did want to give you a very, very quick engagement case study. So one local government that we worked with recognised that young people were missing from the early drafts of their public health plan, and issues such as alcohol and other drugs and mental health were identified in their data, but it didn't kind of flow through into their draft of their public health plan, and they didn't get a lot of response from that group of people in their initial community survey. So because that was missing in their early draft, they decided to start small. They mapped their youth stakeholders and linked with the local school. They ran a short online survey specifically for young people and held 2 workshops with high school students. So they'd worked with the school to do that. The feedback was really clear. Young people were concerned about mental health, access to safe spaces, and opportunities for physical activity. So when it came time to connect the dots, the local government included the issues as priorities in their public health plan. They developed specific actions around youth mental health and safe active transport routes. And finally, to close that loop, they went back to the students in the school to share how their voices had directly impacted the plan. They built trust with them and showed that, particularly to the young people, that their input wasn't just collected, that it was acted upon. So it's a great example of how engagement, even on a small scale, can make a plan more relevant and more meaningful. So once you've done all of that, it's just a simple thing. Once you've got your health profile and consulted with your community, that is really where you can solidify and establish what those priorities are going to be that you're going to tackle. It can be tricky often, as I said, because you're not comparing apples with apples, and there's no one size fits all for how you determine your priorities. To help you in setting your priorities, though, it's worth considering the following principles that are up there. So in ranking priorities and considering which ones are more important, you can look at importance. So looking at the magnitude or the reach of the issue, cost, so that could be financial or social cost, the seriousness of the issue, so the impact on the individual's life, the family, community more broadly, and the proportion of the population affected and any trends over time as well. Whether it's modifiable, it's really important that if you're looking at an issue, can it be modified by an intervention, and in what proportion of the population? So do we know that there's effective strategies and contributions to the greater outcome of risk factors? So what works, what doesn't, and is it cost effective? Opportunities, so are there existing structures and systems to support addressing the issue, and you will have identified those in your engagement, and are there opportunities to fund the initiative, which again could be a totally different webinar. Acceptance, so are stakeholders generally accepting and supporting the issue? Are there similar strategies or programs and interventions that are currently already happening within your local government, but even more broadly in your community? And are these initiatives can support your issue or highlight areas of need? There is a partnerships analysis tool that can support that. I'm happy to provide that as well. Is it measurable? So is there data to evaluate the change that you're implementing? Are you able to measure your strategy's effectiveness internally with the local government or at a population level? And again, does it align to your local government priorities? It is really important that that does be considered across the development of a public health plan to ensure that once the public health plan is developed, it is supported by your council. Very briefly, this is our guide. I'm not going to go into details because I definitely have gone over time. It has recently been updated. It's an interactive PDF and it is available on our website. This is an example of a page within it so that you can see where providing direct links between the objective within the state public health plan, the priority within the state public health plan, and then providing specific strategies, activities, and then helpful resources that you can use to address those strategies. That's another example specifically related to falls prevention, but again, I won't go through it. It is in there. This is the information I was talking about around how to set objectives, how to look at your aim and then objectives and activities underneath. And making your objectives SMART, so specific, measurable, achievable, realistic, and time specific. Again, if anyone would like support or more information, I'm more than happy to have a chat about how we do this. And then including in your objective the who, what, when, where, and by how much. Again, objectives can relate to risk factors, protective factors, environmental change, knowledge, attitudes, behaviours, policy change, infrastructure, and community involvement. So after all that, what will success look like? So priorities that are based on qualitative and quantitative data. So you're looking at all of those data sets, as well as the information that you've got back about the what and the who. You will have increased engagement and plan ownership by the community. You'll have stronger partnerships. You'll have increased trust and credibility with your communities, and you'll end up with actions that target real need within the community. So that was a flyby. If you would like to contact us at all, there's an info at Injury Matters email address there, but my email address was at the very beginning. I'll whack it in the chat while Kelly is talking.
When Suzanne and I first met to discuss the possibility of her presenting on this topic, and how to crunch down what would normally be a day-long workshop with lots of interaction and butcher's paper, and how we could translate that into an hour's webinar online with people all over the state. I could see Suzanne starting to twitch, but can I just say that was a triumph. Suzanne, you have imparted like huge volumes of really useful information, and I can tell from the chat people are exchanging ideas and examples and things that they've come up with, which is proof that what you've given has been heard, processed, and applied already. So thank you so much. And I think for me, the key takeaway and the line that keeps repeating in my head is, what can your local government influence? So Sarah from Cambridge just noted in the chat that perhaps North Metro Health Service Health Services might have helped her with identifying the health priorities of the residents in your local area. But this is really taking that data then and saying, well, what can we influence and what would my council support as well? So it's thinking through, well, what aligns with where we're already understanding our community is wanting us to invest our money, resources, and their rates, because there's always those bigger considerations. What's the appetite for action in these particular areas? So it's sort of moving from the data and the information that you're collecting to then translating that into an action plan. So where is that appetite for risk, for partnership, for collaboration? It's all those. For me, that's where the magic happens, because that's where you can really work out how to bring this plan to life, but also so that you are left, or the local government is left with a plan that can be implemented, and it doesn't just sit on the shelf because it's too hard and too overwhelming and there's too many actions, and it sort of blows people's minds, so they just get scared and can't look at it. So it needs to be a really practical document that can be implemented as well.
Absolutely. And part of that engagement, as well as identifying, I'm sure a lot of people online wouldn't have known that Injury Matters can support not just with the development of a plan, but with the actual implementation of strategies, particularly related to falls prevention, because we go across the community there. But in relation to a lot of, and we have partners in that space. So it's taking that next step. But one of the points that I'm sure everyone knows Kirsten Beckenham from City of Armidale had said before that I found really helpful is that having a look at other local governments, like acknowledge if you're actually utilising things, but when with their public health plan that they've just developed, that's exactly what she did. You know, she looked at it was their third one, so they're a little bit down the track than a lot of local governments, I think, in terms of doing their third, but really had a look at elements that she wanted to bring in from other public health plans, and they don't have to be, and particularly at this stage, a absolute capture all. They're real, you know, you're really looking at what are we doing currently as your foundation, and then kind of identifying those gaps where you've got the opportunity to have influence and the resources to actually be able to do it. All local governments could write these gold standard public health plans, but whether they can be implemented is a totally different thing. And as you said, that appetite from a council and local government perspective to agree to them is really important.
Brilliant. In the interest of time, we'll throw to Kelly because you've been waiting so patiently. Thank you, Kelly. And I'm looking forward to hearing sort of how you've gone about this process as well. We've got 15 minutes, Kelly, if that's okay. And I'll check with you whether you're happy to share your slides as well. Otherwise,
yeah, we can.
That's great. Thanks a million.
Yeah, can everyone see my slides?
Yep, it's all good.
All right.
You might just want to pop it in presenter mode
Yep.
down the bottom there.
All right. I'm just going to move. That thing keeps on moving right in front of my slides. I'm just going to move that over. All right. Thank you, everyone, for having me. And thanks, Suzanne. That was amazing. Your presentations are always amazing to listen to. Always pick up something new to learn from. All right. I'm just hoping my slides are... it's not going. Oh, can everyone see that? Yep. I can't see my notes.
Kelly, if you just click the three little dots, yeah. And then go show presenter view.
Oh, that's much better. This little cursor thing just still keeps coming right over my thing. All right, so the city is developing their third public health plan. Our first one was launched in 2010, and then our second one was launched in 2021. But that was only a 3-year plan and ran out in 2023. So we only have one FTE dedicated to develop our and deliver our plan. So that's one health promotion officer, which is me. So I oversee the plan. And I also, it limits the capacity of delivery because there is only one person. So my role is to collaborate and partner with other business areas within the organisations to ensure the implementation of the plan. So our previous plan was developed by a consultant, but this time around we decided to go internally because I have had a lot of experiences developing other previous plans. So we thought the best option was to deliver it ourselves, and I found that, you know, the previous plan was very broad and it was very, very hard to report on. So we have really simplified the process this time around. So we did start the process off in Jan 2023, and that seems like a while ago now. But our plan was put on hold for almost a year because our executive team wanted to wait for the state public health plan to be released so our plan could align. So there has been 2 check-ins with council before and after the consultation. We have a workshop with council on the 9th of September to obtain their feedback and seek their approval to go out for public consultation on the draft plan. So hopefully our plan will be endorsed by council either in November or December this year and launched by the end of next year. So I won't go into our consultation process too much, but this process probably took about 4 months. So we did have a stakeholder workshop with all relevant government departments, organisations and community groups. We also held workshops with all our advisory groups, so that's Access and Inclusion, Environment and Youth. We met with the elders from Nijala Wangamaya, which is our Aboriginal health service. We consulted with various different networks. We completed an online survey. We also did a quite comprehensive staff consultation, and we reviewed all our existing consultations that had taken place during that time. So during that period of time, we had a lot of plans being developed. I think we had probably about 6 or 7, including our community strategic plan. We also had our community safety plan. So, looking at some of the issues around alcohol with that one. The environment strategy really linked to our climate change area. The place enrichment and arts and cultural strategies had a lot of mental health components in their consultation, and our integrated transport plan linked with our active transport plans. All right, so our one-to-one meetings, it was really quite critical and important. I know this is really, really time consuming because you're meeting with individual teams or sometimes just individuals to find out what's really happening across the organisation and how the public health plan is aligned. It's also a good way to acknowledge their achievements in this space and provides an opportunity to get each business area perspective on what should be included in the new plan. It also provided ways to investigate for partnerships, shared operational activities. So, for example, this year I delivered a healthy eating workshop for people with disabilities. So this was a partnership between our Access and Inclusion Officer. We shared our budget costs and shared the workload. Also, with our outdoor fitness, I don't have capacity to deliver that. So out of my budget, I'll pay a staff member from our recreation centre to deliver that project for us. As I said before, I can't deliver on every component of the plan. So this is really important to bring people on board. And it's also good to discuss with the other teams what barriers that they were facing to try and solve some of the issues. Of course, majority of the barriers were related to funding. All right, so how we identified our priorities. So I'm not going to go into the data too much because Suzanne has already spoken a lot about that, but we went through all those data sets that Suzanne spoke about, and then also for our demographic stuff, we went through our the census ABS data. We also, in our plan, we compared the data from 2012 to 2016 to 2018 to 2022 to see if the rates have increased or decreased, and we also compared to see how we were tracking against the state average as well. We also did that with the chronic diseases and mental health conditions with the Greater Perth. We also reviewed the social economic disadvantage in some areas of Mandurah, and also our population has a huge factor because Mandurah has 32% of the population are over 60 compared to Perth, which is 21.2%. So we also analysed the feedback from our consultation process. So this involved developing an engagement report highlighting all the feedback, collated from that process, and also to identify some key themes and what priorities that the city could deliver. We also needed to consider, our staffing and our operational budget, because some ideas or suggestions weren't realistic for local governments to deliver on, and all that may sit with the federal state governments, like running of hospitals. So it was also identified that external and internal partnerships are essential to deliver our implementation plan. The city also invests in funding opportunities to fund other activities. Some of these include, the grants that have already been mentioned from Injury Matters for fall prevention. And then recently we just received a $35,000 grant over 2 years for suicide prevention training to address a need in our community. And we are delivering Aboriginal mental health first aid and a range of different suicide prevention workshops that we wouldn't been able to fund out of our operational budget. So this is why it's important to look for funding opportunities out there to meet the need of the community. So the new plan is directly aligned with the State Public Health Plan. We have 4 pillars, which is very similar. We have the promote, prevent, protect and enable. And also when developing the plan, it's really important to consider your priority population. So for us, it's people with disability, Aboriginal, older adults and people with multicultural backgrounds. So that needs to be reflected throughout the implementation plan. So I'm just going I'm seeing how much time I've got. I've got a couple of minutes. I was just going to give you some examples of these are our 4 areas. And I was just going to provide a couple examples of how we partner with other people, or will be partnering with others to deliver this. So our first one, empowering and enabling people to live a healthy lifestyle. So, through that we do a lot with our, we spend a lot of money on our share footpaths, our public open spaces, but we really need to inform the community about that. So that's a really quite vital to ensure that people are accessing those facilities and know about them. I've already mentioned also we promote and fund programs initiatives that are aimed at injury prevention. So we do a lot with our senior centre around balance programs. We deliver a range of mental health training workshops, but once again, we don't have the funding to put on an array of workshops. So, recently I've just partnered with Nemi National to deliver youth mental health first aid. So we provide them with a venue and then they fund the rest of the training, and we just promote and keep registrations of the workshops, and that's a really great partnership. I think we've done about 5 different workshops with Nemi National now. And just lastly, we're working closely with the Peel Volunteer Resource Centre to strengthen volunteer support in the area. Our second theme is to advocate and support preventable initiatives. I can't see the title. I've got the thing on it. Sorry. And influence positive. Sorry, I can't see the title. My little thing's covering it. But I'm sure you can see it. Thank you. So some of the examples that, we've been working with the community gardens to try and do that promotion of healthy eating, doing a range of different workshops with them. And that's also encouraging the community to find out about the community gardens and get to know what's happening and get involved. We did deliver a range of healthy eating workshops. We've also we have a local drug action team who have just done a vaping campaign, which I've heard from the alcohol drug foundation that we're the first local government in WA to actually deliver a vaping education program. So that's, we are reliant on funding for that, but that's something that we're going to be expanding on in the next few months. And also we do a whole range of different initiatives for, different campaigns. We do a lot with Women and Men's Health Week. And this is not just delivered through me. This is delivered at our seniors, at our youth development team, through our recreation team. So it's through our libraries, it's delivered across the organisation. The next one is the, just responding, the protect, I suppose, which is all our responsibilities under the public health plan. So this wasn't really included in the last plan, but I feel that it really should be included in your plan because you're already reporting on that as it is. And it also involves, delivering that new climate change which is new to the state public health plan. So this would, need to be done in partnership with our environmental team and emergency management team. So yeah, and there's also building on the other state and federal campaigns in this space. So Fight the Bite and Play It Food Safe. And our last theme is, providing health protection for the community. So this is really advocating for that essential health workforce and services in the area. We also partner with South Metro Health Service. I see Corinne was in on this chat. We've done lots of different partnerships with them in the past, and they've been really successful. It's been a really great positive relationship. And we're really also supporting our local health services with Nijala Wongamaya and our other Aboriginal medical services through this space. And also funding, sorry, I just lost my spot. Funding a lot of education awareness to improve outcomes for people with multicultural backgrounds, people with disability and older adults. So I know that I'm pretty much finished, but I just wanted to, finish there. And if anyone wants to have a chat to me, sorry, I've rushed through that a little bit. I'm more than happy for you to contact me, or if you would like to meet with me to find out more about what we're doing. Once our public health plan is ready for public consultation, I'm happy to share that with the group as well. Thank you.
Kelly, you're a superstar. Thank you so much for imparting that wisdom in such a short period of time. And I think we could listen to you for another half hour, talk about sort of how you got through all that. You make it sound easy, but it's definitely not. And the City of Mandurah is very lucky to have such a dynamic health promotion officer. But also I can hear in your story how important that work with the South Metro Health Services team is, and I think Gabby and Karina are on the line, and others that are doing so much vital work to support local governments in your area. And Asunta, yes, you too are doing amazing work. I can see you in the chat there with your team at North Metro, and Colby and Jack are on the line from East, and I hope we've got some WA Country Health Services reps on the call as well. So just a reminder, lean on those resources that are out there that are standing by, wanting to support you in your local government teams to develop these plans. They have access to further data. They can help point you in the right direction to partners that are standing by to build your expertise in this space. For those on the line from regional and rural local governments, you might be listening to Kelly talk about all these different amazing people working in the city of Mandurah and thinking, well, we don't have any of those resources. We can't do that. WALGA is very conscious of the diversity of contexts that everyone is working in here, but that's why we keep reiterating, think about the work you're already required to do. So every local government is required to be working on emergency management arrangements at the local level. You're all required to be engaging with your community to shape your community strategic plans and inform those mandated reporting and governance plans required under your governance structures. So lean on those things that already exist that other areas of your local government might be working on. They might be in the planning team, they might be in the waste management team. Go and talk to people that are responsible for collecting rubbish and recycling, and think and you know, understand what initiatives that they might be able to you know, feed into your plan that you might not have been aware of. So it's a big task, but there's lots of there's a network of resources and people and experts and colleagues as well in other local governments that can support that work. There's Suzanne has put some amazing links in the chat that you can pursue to follow up if you would like more information about the one-on-one support, the workshops and upcoming events and grants that Injury Matters offers. Colby has just posted from East Metro Health Service details of an event that just came into my inbox this morning. So I was rapidly asking if we could share that information about East Metro's upcoming workshop on leadership. Sorry, I'm just scrolling up the chat as we talk about local government leadership, creating healthy communities. The team there is amazing. I imagine that one is in person, Colby, I think. If I'm correct there, you can jump in. So if you're in the metro area or visiting at the time, that might be something that you'd like to participate in. Just a reminder, and we'll put details of this on our webpage as well, but the amazing team at South Metro Health Service has a webinar coming up called The Heat is On, which will be dealing and looking directly at that new priority in the State Public Health Plan around reducing the health impacts of climate change and looking at how you can build some heat wave planning strategies and plans to reduce the effects of heat on our most vulnerable cohorts within our communities through your local public health plans, but also just through work that we might do outside of that context as well. So that's coming up on the 11th of September, and that one is online. So if you're in Broome or Kalgoorlie or Esperance or Wongan Hills, please follow through and register for that one. I think it's going to be really kicking off a long line of capacity building and expertise sharing in this space. In the interest of time, I'm going to call it a close there without calling for questions, but you have everyone's details. Please reach out to them if you have any questions. Are there any closing comments or reminders that anyone would like to just call out before we wrap the session up? Assunta, you're on screen. Did you want to jump in? No? All good? We'll see you at the next webinar series and look forward to catching you at the next gathering of this great community. So thank you very much.